It is Sunday, May 9th at 11 a.m. My patient has just reported feeling nauseous. I've checked the medication orders, and there's an order for Ondansetron or Zofran for 4 milligrams by IV push as needed for nausea and vomiting. So I will be administering this to the patient. First, I need to do pre-assessment, make sure the patient doesn't have any allergies. Pre-assessment wise, I need to assess for nausea and vomiting. Patient reported nausea, there's no vomiting. Checking for abdominal distension and listening for bowel sounds. Those were all within normal limits. And so now I'm at the Pyxis. Well, I've also done my dosage calculation for this. 4 milligrams it's available at 2 milligrams per ml. So I will be administering 2 milliliters of Zofran via IV push over 2 minutes, and that breaks down to 0.5 mLs every 30 seconds. So I'm at the Pyxis. I log into the Pyxis. I find the patient's name, match it up with the MAR, patient name, MRN, date of birth, match it in the Pyxis, and then find the medication. This is where I do my first check. Right drug, Zofran, right dose, 4 milligrams, right route, IV push, right time as needed, every 6 hours. The patient has not received this medication yet, and right reason due to nausea. So I can get the drug out of the Pyxis, and this is where I do my second check, making sure it's the right medication, Zofran, right dose, 4 milligrams, right route, IV push, right time as needed, so right now, and right reason due to nausea. So I can put that away, and now I need to withdraw. I need to get this into a syringe. So I need a syringe. I've got the vial. I've got a safety cap and an alcohol swab. So perform hand hygiene, release the cap, and vigorously clean with the alcohol swab. Throw that away, let that dry, and while that's drying, I can open up my syringe and attach it. I take the cap off and leave that ready. So we're getting 2 milliliters. So I need to pull 2 milliliters of air in the syringe, inject it into the vial, and then draw 2 milliliters of medication without getting any air bubbles. All right, we're at 2 milliliters. I will recap this using the one-handed method. Secure it in. And now we need to label the syringe. I have a label here that I made with the name of the drug, Zofran, and the dosage amount, which is 2 milliliters. Put this on the side that does not have the numbers. and I'm ready to go to the patient's room. Well, I need to gather equipment as well. So I need alcohol swabs, flushes, and the medication. And now I'm ready to go to the patient's room. Oh, one other thing that I needed to do when I checked the medication before drawing it is checking the expiration. The medication was not expired. Um, that is something to check before even drawing the medication. So I come to the patient's room. Hello, Mr. Johnson. I have your Zofran here for you. I'm performing hand hygiene. This is your antiemetic to help with your nausea. Once again, I need to ask the patient if they have any allergies. I need to check the patient's ID bracelet, comparing with the MAR, the patient's name, MRN, and birthday. Have the patient tell me their name and date of birth. Have the right patient, and now I'm ready to perform my third check in front of the patient, comparing the medication with the MAR, making sure it's the right medication, Zofran, right dose, 2 milliliters, right route, IV push, right time as needed, so now, and for right reason due to nausea. I perform hand hygiene again and put on clean gloves. And first, I want to assess the patient's IV site, checking for inflammation and infiltration, any redness or swelling or warmth coming from the IV site. I need to stop the infusion, pinch the IV site, and clean the port with an alcohol swab, cleaning this vigorously for 20 seconds. And I'm choosing the port closest to the patient. So I hold on to that. I get my first flush. Make sure there's no air in the flush. Connect it. And I need to slowly aspirate the IV site for blood return. After releasing the pinch, I will aspirate slowly. There's blood return. So now I can flush the IV with 5 mLs. There we go. And this whole time I'm making sure not to touch the end of the port or the ends of the flushes or the end of the syringe. So now I'm ready to administer my medication. I will unscrew the cap and attach it to the port. And we're administering 0.5 mLs every 30 seconds. In the port here is 0.5 mLs. So the first time I need to administer 1 ml, which I will do now. So we've administered 1 ml. 0.5 is in the patient. The other 0.5 is here in the tubing. So I wait 30 seconds and then administer the next 0.5. And now while we're waiting for this time to go by, I can take this time to teach the patient about antiemetics, about the serious side effects like irregular heartbeats or serotonin syndrome, how to detect that. Signs and symptoms of that is agitation, delirium, dizziness, tachycardia. and also there could be involuntary movement of the eyes, face, or limbs. If any of this occurs, they need to contact either me or the provider if they're at home taking this medication. 30 seconds is up. We will administer the last 0.5 mLs. So there's no more in the syringe, but there's still some in here. So we detach the syringe, attach a new flush, .30 seconds has passed, and we will inject 0.5 mLs. But since this is the last dose, I can flush it with 5 mLs or the whole flush if I want. All right, so we did 5 mLs. We'll detach that. I will discard the syringes in the sharps container, remove my gloves, perform hand hygiene, and document the administration of the drug. I also need to continue with the infusion and check back on the patient and make sure to check for medication effectiveness within the appropriate time.